Welcome back. Well, it used to be when you go to the hospital to have surgery, that means staying the night, at least a night or two. But now for many procedures, you can come and go the same day. Dr. Ted Mazur with Alvarado Hospital is here to talk about the types of procedures that can be performed in an outpatient surgery center. Welcome. Thanks for being with us.
Good morning. Pleasure.
Now, there's a lot of surgeries I think that would surprise some people that can be done in an outpatient surgery center, right?
A lot of people think of outpatient surgery for biopsies, for very minor procedures. Used to be we'd put people in the hospital 8 to 10 days for tonsillectomies. Those are now all outpatient, pretty much all outpatient. But we are now much more advanced than that between safety issues that have been addressed and equipment issues that have been addressed. We can now do very extensive surgery in the outpatient setting, orthopedic procedures, gynecologic procedures, plastics procedures. In my field, ENT, we can do advanced sinus surgery procedures, all of that in the outpatient day surgery, or even with a brief overnight stay, still considered outpatient away from the hospital. We do things like thyroidectomies now that you never would have thought as being an outpatient procedure just a few years ago.
Now, is this something where people have to ask their doctor and say, hey, can I have this done in an outpatient surgery center, or is this something the doctor would automatically just recommend?
I think it's both ways. I think it's a conversation that you need to have with the doctor if the doctor doesn't raise the issue of this can be done outpatient. And not all patients are going to qualify for outpatient surgery. It has to do with their overall health as well. One of the things we focus on in the outpatient setting is safety, and even minor procedures on someone who might have cardiac disease, not necessarily the safest thing to do in the outpatient setting, just in case there's a complication. But do raise it.
And one of the main benefits, obviously, in outpatient surgery is you get to go home the same day. You get to have the surgery, you get to go home and then recover in the comfort of your own home. Plus, you save a little bit of money, possibly on your insurance deductible. But there are other advantages as well.
Well, I think let's address the cost issue first. A surgery center has to maintain high-tech equipment, has to maintain standards, but it doesn't have to cover costs for ancillary services that a hospital might, like an emergency room. Those allow the costs to be based much lower, and in many cases there are advantages to the patient and to the insurer for doing an outpatient setting. For the patient, in addition to the safety factors, we are dealing with high-quality physicians, the same physicians that are going to operate on them at the hospital, anesthesiologists, and most centers only anesthesiologists, some centers use nurse anesthetists. But more importantly, the patient comes into a non-hospital setting. It's very warm. It's one-on-one. They have a private room in which they wait for the physician. They walk usually into the operating room. They're not gurneyed in. When the surgery is over, they go to a very small, quiet recovery room where there are no very complicated patients occupying a lot of nursing time, and the nurses get to spend much more one-on-one time. They then walk over to an easy chair and they sit in an easy chair for a little while to make sure they're doing well, and they go home sometimes with flowers in hand. It's a very personal type of setting.
So the patient really feels like, and we just saw it on the screen, feels like they're really getting specialized attention.
And they are. They don't just feel that way, they are getting very special attention.
And again, same staff, same doctors, same nurses. These aren't, any different than you would get if you went to, the main hospital.
Absolutely no lesser standard of care from beginning to end, from the credentialing process that goes on to the equipment maintenance to the oversight.
And Alvarado has a new outpatient surgery center, right?
Yes, we are reopening an old surgery center that's been refurbished, and it's going to be using all sorts of new equipment. The new physician surgery center on the Alvarado Hospital campus will be opening shortly.
All right, perfect. Dr. Ted Mazur with Alvarado Hospital. Thanks so much for coming in today.
Thank you, Greg.
All right, some good information. And there you see the information on your screen for Alvarado, alvaradohospital.com or 1-800-ALVARADO. All right. And for more information, as always, you can go to our website, san diego6.com.